So, good afternoon, everybody, and welcome to this speaker forum, the April speaker session of ASHA USA. My name is Saili Amrapurkar, and I am the executive director of ASHA USA. As some of you know, ASHA USA is a non-profit organization focused on working towards health and harmony in the South Asian community in Minnesota. We do community education, research, and programming for various age groups, including a monthly group for South Asian seniors in the community. So, for more information, please visit our website www.ashausa.org. Now, April is National Minority Health Month. And so, to learn more about the South Asian health issues and also about a care registry, which is a collaborative that has been started in California to address and reduce disparities in research participation among Asian Americans and Pacific Islanders. So, today, to talk about this, we have with us our expert. Let's welcome Dr. Alka Kanaya, who is joining us all the way from California. Thank you, Alka, for joining us.
Thank you. Thanks for having me.
Yeah, and I'm going to quickly go over your bio. So, Dr. Alka Kanaya is Professor of Medicine, Epidemiology, and Biostatistics at the University of California, San Francisco in internal medicine. She has focused her research on Asian American health disparities over the past decade. She is leading the mediators of atherosclerosis in South Asians living in America. So that's MASALA, Masala study, to better understand factors that explain the high rates of diabetes and heart disease among South Asians. She's a practicing general internist at UCSF and teaches residents and fellows both clinical medicine and research methods. We are extremely thrilled to have you with us today. And without further ado, I'm going to hand it over to you. So take
Thank
it away.
you. Thanks so much. I'd like to talk today mostly about tips for how to maintain brain health as we age. And I'm going to leave lots of time at the end, about 20-25 minutes for discussion, questions, and answers. So the three points that I want to go over today is what is Alzheimer's disease and what is dementia. These are often used as interchangeable terms, but they're not quite interchangeable. So I want to really explain what we mean when we say one or the other. And then how can you lower your risk for dementia? That's the main point of this talk. And how can we keep our brain healthy? So we know that with aging, there are normal changes that happen in memory overall. There is some slowing of thinking ability. There is some more difficulty in paying attention for longer periods of time. And, even I'm starting to notice that I can't pay attention more than 35 to 40 minutes on Zoom. It's a very taxing platform to be on. More memory cues are often needed. So things that used to be more simple to remember will often, take a little longer to remember, or we'll need some cues to remember names or places or people. And then the sensory system does change. So the sense of hearing does go down, sense of vision changes, and the sense of taste. These are, midbrain senses that are changing with just aging. So these are normal changes in memory. Then what is dementia? Dementia is not a normal part of aging. It is absolutely not something that is expected if someone lives long enough. It's abnormal. And dementia is defined by having problems with many different domains in the brain, having problems with language, which comes from a very specific domain part of the brain, having problems with memory. Most people think of dementia as being memory loss, but it's just one of the things that is affected. Having trouble with judgment, having trouble with reasoning and thinking through, problems. And these problems can affect the ability to live life. And there are many causes of dementia. And that's the thing that I want to impress upon you, that there isn't one thing. And there's many causes of memory loss. Now, memory loss, again, is one component of dementia, but some of the causes of memory loss are aging, like we've talked about. Medications can cause memory loss. Not all of them, but certainly having multiple medications can do that. Depression can cause some memory loss. Having poor nutrition and having a lack of certain vitamins, like vitamin B12 being the most important one, thiamine, another one, folic acid. These nutritional vitamin deficiencies can cause memory loss. Being dehydrated, and that can come as a result of just not keeping up with fluid needs or being on medications that cause a lot of fluid loss. Thyroid problems can cause memory loss. So these are, it's important when you are experiencing memory loss or you're experiencing a friend or a spouse who has memory loss, to see your physician, your provider, to make sure that these reversible causes of memory loss are addressed. So how can medications cause memory loss? I get a lot of questions about this. We know that on average, older Americans can take 5 or more prescription drugs. And as we age, there is a change in how our bodies can metabolize or break down these drugs. Most medications are metabolized by the liver or the kidney. And with aging, there may be some slowing of the breakdown of these medications or kidney clearance of the medications. Other drugs may actually affect how you metabolize a drug as well. So having a combination of drugs can interact with each other. So back to our definition of dementia. Now, dementia is not just memory loss. It includes all of those other things, including, judgment and being ability to think and reason. So there are many types of dementia, and you can see here in the middle, Alzheimer's disease is one of the many types. It is the most common type, but it is, again, there's other types. Frontotemporal lobar degeneration is one type of dementia. Creutzfeldt-Jakob disease that can affect different parts of the brain is another type. Lewy body dementia, and then Parkinson's disease can cause dementia as well. So if we look at the whole body of different types of dementias, Alzheimer's probably accounts for the biggest group, and that's about 60 to 65% of all dementias are Alzheimer's. And that's why some people use dementia and Alzheimer's interchangeably, because it is the most common cause of dementia. But there are these different types of frontotemporal, the Parkinson's, and vascular dementias. So what do we know about Alzheimer's disease? It does affect about 6 million adults in the United States currently. About 2/3 of people with Alzheimer's are women, and it seems to be more likely in African Americans and in Hispanics. We really don't know about Asian Indians or South Asians, how prevalent Alzheimer's disease is. And that's really one of the reasons I'm here, is to ask, communities that I work with, communities that I belong to start getting involved in research studies, because not being represented in these studies just does not give us any information about our communities. So we also know that 1 out of 10 older adults over the age of 65 has Alzheimer's in the United States. And the costs are going up. In 2019, Alzheimer's cost about $290 billion, and it's projected to cost over $1.1 trillion by 2050. So when I see patients in clinic as a general medicine doctor, and this is the typical way that I end up seeing a patient who ends up finally, after many tests, gets diagnosed with Alzheimer's, and that is that there is short-term memory impairment. So a patient can come in, or their spouse or their child brings them in saying, my mom or dad, they're not remembering as well as they used to. They're forgetting things that happened yesterday, or they keep asking the same questions again and again, like, what are we going to do today? What are we going to do tomorrow? And that's quite distressing to the family, to have to repeat the same questions, or to see that their parent or their spouse is having this problem. Often long-term memory remains okay until later in the disease, since that's not really affected. So people who are having early presentation of Alzheimer's may remember their childhood really well, may remember friends and things that happened when they were young really well. It's just the record button on new memories isn't working. So the new memories are just not being able to be recorded and remembered. There may be impairments in other domains. Like I said, memory loss is not the only domain that is affected with Alzheimer's. There may be some changes in language. So a person who has learned 2 or 3 languages in their life, they can often remember their first language better than their newest language. So if English is a newer language for a person, they may have trouble remembering more English words. But if they grew up speaking Hindi or another language, those skills may be just fine. So this is a very interesting finding that English skills seems to diminish in people who are not native English speakers. Orientation, and by that I mean not knowing the date, not knowing the place, not knowing the person, like these things that we orient ourselves in life with are the ones that kind of slip, like not remembering what the day of the week is or the month of the year is. And then other executive function skills. By that I mean like balancing the checkbook, paying bills. These are things that we need to be able to use different parts of the brain, and they're called executive functioning. So these are things that can start to become impaired. I do want to point out a Netflix movie that a lot of people may have seen, but I do recommend it because it's about a doctor in India. He's a Punjabi man, and it's called Mango Dreams, the movie. And he is a physician, and he starts to notice that I'm letting things slip. I'm forgetting things that I need to do for my patients. And he himself is worried that he is starting to go down a dementia road and maybe developing Alzheimer's disease. So what is going on in the brain for someone to have Alzheimer's? And these are brain cross sections that are under the microscope after someone has died and they've had Alzheimer's. And one thing we know is normal brain tissue is this pink with these blue dots, which are the nuclei of normal healthy neurons. But what happens is these brown amyloid plaques. Amyloid is a protein that's abnormal that deposits in the brain and kind of, messes up the thinking process as a result. That's the current thinking of what amyloid is doing. There also may be tangles, neurofibrillary tangles, and that's represented on this picture, showing these little long areas that just aren't normal in how the brain looks. So these are the 2 pathophysiologic abnormalities that have been seen on brains of people after they have died of Alzheimer's disease. We know that aging is a risk factor for Alzheimer's. So when we look at how many people between age 65 and 74 have Alzheimer's, it's quite low, less than 2%. 75 to 84, it's almost 20% have developed Alzheimer's. 85 and above is almost 40%. So it does go up, but again, it's not inevitable. This is something that I do want you to take home is I'm going to go through 10 tips. And aging is one that is certainly not under our control. So here's the first tip: stop aging, not under our control. But you'll see that 8 of these tips that I go through are definitely within our control. So the next thing that's not in our control is the familial risk of Alzheimer's. We know that there is an inherited form of Alzheimer's disease, but that only accounts for 2% of all Alzheimer's cases. And that's a mutation in 3 genes. But 98% of all Alzheimer's disease is not caused by 1 or 2 mutations. There is this increased risk of almost 1.5-fold if you have a parent with Alzheimer's disease, that you may have a 1.5-fold higher risk of developing Alzheimer's. And there seems to be a stronger effect of the maternal side of the family. So if the mom and the grandmother in the family had Alzheimer's, there may be a stronger risk for the person. So what we know about these genes for Alzheimer's disease, these are the 3 in the top left here that have been shown to have some genetic mutations and that can cause Alzheimer's, but they are really rare. The frequency is very rare in the population. So this is not something we test people for because it's so rare. But we know that there are many more common genes that can have a few mutations, and a bunch of those common genes may be what's underlying this familial risk of Alzheimer's disease. So currently, we don't screen people with genetic tests to say you're at more risk or not for Alzheimer's disease. People with a strong history of these genes can be tested. So 10 things, again, to keep in mind. The second is choose the right parents, get the right genes. Again, totally not in our control. So for the rest of this talk, let's really focus on what is in our control. So risk factors, obesity. We know that obesity increases the risk of developing Alzheimer's disease. So in the blue is people in midlife who were obese, and they had almost a 30% higher risk of developing Alzheimer's disease than those who were normal weight. So this is something that needs to start earlier in life, where you have to really be careful of the weight gain in middle life, because we know that there are so many changes that happen in the body, with other side effects of obesity, call it that, with high blood pressure, diabetes. These are all downstream effects of obesity that we really want to make sure we avoid. Cholesterol is associated with those amyloid plaques in the brain that I showed you. So LDL cholesterol is low density cholesterol. As low density cholesterol levels go up, there is higher rates of amyloid protein. So this shows an increasing rate of amyloid protein with higher cholesterol. HDL is the protective form of cholesterol. And as HDL numbers go up, there's a lower rate of amyloid protein. So these are correlational studies. They're not proving that cholesterol causes Alzheimer's, but they're showing there's correlations between good and high levels of bad cholesterol with having this amyloid. Smoking can cause lots of vascular changes in the brain and can also lead to Alzheimer's disease and other dementias. So 10 tips to keeping your brain healthy. This is the first one that is more in our control, and that is to control cardiovascular risk factors. So if you are obese, to really start working out, really start eating well, eating healthy to avoid diabetes, work on your cholesterol. If you can't do it with diet alone, many can't, there are good medications for controlling that risk factor, and stop smoking. There are many ways to get help to stop smoking. What about your diet? Everybody is very interested in diet kind of being one very modifiable cause of disease. Some foods may be helpful, but the results that we have come from epidemiologic studies, not from randomized controlled studies. And what do I mean by epidemiologic? These are studies where people are followed for many years, and we record what they're eating at baseline, and then we see who develops Alzheimer's disease and who does not. And the people who reported eating a lot of green leafy veggies like kale, spinach, broccoli, these types of veggies are associated with good nutrients like vitamin K and folate and beta carotene. Those people eating a lot of those had less Alzheimer's disease. People eating more fatty fish like salmon and tuna, which have a lot of omega-3 fatty acids, those people had less Alzheimer's disease. People eating more berries, flavonoids that are pigments in berries, they can also help improve memory. Tea and coffee may also have some benefits on short-term concentration and memory. Walnuts is probably one of the best nuts in terms of the type of healthy fats, omega-3 fats that they contain, and they can also help with some improvements in memory. So in some studies that have been done, they looked at people who were eating fish, and they asked, how many times per week do you eat fish? And there are never, no fish consumption at all. And who developed Alzheimer's disease? People eating fish 1 to 3 times a month, people eating fish once a week or more than twice a week. You can see there was a much bigger reduction in the risk of developing Alzheimer's disease the more fish that was eaten. What about the Mediterranean diet? We know that so many good things have been seen with people who consume more of a Mediterranean diet with olive oil and lots of good nuts and fish. So they did a study where they randomized people to getting a Mediterranean diet with extra virgin olive oil, so more olive oil than they were already eating, then getting a Mediterranean diet plus more nuts, and then a control diet, which was not a Mediterranean diet. And they found the people eating either the olive oil or the one with the nuts, they had better memory than those eating a different diet. They also found that there were benefits in the frontal cognition areas of the brain and global brain function as well in the two Mediterranean diet groups compared to control. So other dietary factors that we have found from many more studies are certain foods that are rich in vitamin E, like oils and nuts. They can also help with memory. Vitamin C fruits, citrus fruits like oranges, grapefruits, they can help as well. We've already talked about green leafy vegetables that have high folate amounts. Cruciferous vegetables, I mentioned broccoli, but also cauliflower and other veggies that are in the cruciferous family, like Brussels sprouts. Vitamin B12. Now, this is the one vitamin that I do recommend that patients who are vegetarian or vegan should be taking a supplement of B12 because B12 is mostly found in animal products, in meat, fish, poultry, eggs, and milk. So if you're vegan, you're not getting hardly any B12 in your diet. So I really do encourage you to check your vitamin B12 levels because low B12 has definitely some effect on memory. Some find that there's a chemical in red wine, resveratrol, that may be beneficial, but you would have to drink a lot of red wine to get enough of that, and I don't recommend that. DHA and omega-3 fatty acids in the fish and then the nuts we've been talking about. I really recommend that people get their vitamins and antioxidants in the foods they eat and not with pills. So even though there's some, amounts of pills or doses that are shown here, that's really not the best way to get to these. It's through foods. So turmeric has been one that a lot of Indians have said, what about turmeric? What about haldi? Yes, it has antioxidant properties and anti-inflammatory, and there's some small studies that showed some improvements in memory as well, and so did soy. So you want to avoid foods that are high in fat and high in cholesterol. So definitely this is in our control. Eat a healthy diet. What about high blood pressure? So here's a picture of the brain without the brain tissue, but just the blood vessels. And you can see there's so many, such a rich network of blood vessels are in the brain. The brain is only 2% of our whole body weight, but it uses 20% of the blood oxygen supply in the body. So it's quite rich and very nicely, perfused. And what about blood pressure? So here's a study that was a randomized controlled trial where half the people were randomized to standard blood pressure control, that they could be around 140, 150 over 90, didn't really have to be strict. And then the intensive group, they wanted to get their blood pressures down close to 120 over 80. And those intensive group people required 2, 3, or even 4 medications to bring their blood pressure down. But what they found was that people with the lower blood pressure had much lower incidence of developing dementia. So that's why blood pressure control is important, but we have to make sure we balance that. The blood pressure can't be so low that people are getting dizzy and falling. So there has to be some, moderation in how low we go. But getting close to normal is better for the brain. So control high blood pressure if that is a problem. And most people, as we age, the blood vessels become less elastic, they become stiffer, and that can cause blood pressure to go up just by aging, not because of anything else that's happening, like with salt intake or other things. But eating a low salt diet can definitely also help control blood pressure. What about sleep? So here's a study where they looked at people and how efficiently they sleep. So what do I mean by sleep efficiency? So sleep efficiency is a term about how, when you get into bed, how long does it take you from the time you enter bed to the time you're out of bed? How much of that time were you actually sleeping? So someone who gets into bed and falls asleep right away and then wakes up in the morning, gets out of bed, and has been sleeping the whole time has 100% sleep efficiency, and almost nobody has that. But we, in the study, find that people who had 89% sleep efficiency had much lower amounts of that amyloid protein in the brain, and that amyloid protein we don't want in the brain. So people who were actually poor sleepers, less efficient in their sleep, less than 75%, had much more of the amyloid protein. So again, this is a correlational study. It doesn't mean that poor sleep efficiency caused amyloid, but these are correlated. So could it be the amyloid that's already there for some other reason is making sleep worse? Yes, it's possible. We don't have great prospective studies. So what do we know? Why would sleep help? So one of the thinkings is that not only is there all these great blood vessels providing good blood supply to the brain, but in blue, in light blue here, is showing a cross section of the brain where it's showing the lymphatic drainage from the brain. So this is a pathway where the toxins that are produced by all these active cells that can be removed when someone sleeps, so that it kind of refreshes the brain, gets rid of these old, broken down byproducts that the brain cells have been consuming. It gets rid of it. And so this glymphatic system in light blue seems to work best if there's a good amount of sleep. So get a good night's sleep, something again, in your control as much as possible. What about head trauma? So people who have experienced head trauma earlier in life are a little more likely to develop Alzheimer's disease later in life. And there may be some interaction with your genetic predisposition, but we know that injury itself may also cause increases in that amyloid B protein that was in the brain of people with Alzheimer's. Even recovering from a concussion or head trauma can cause more of this Alzheimer's, this amyloid protein in the brain. So as much as possible, it is really important to protect your brain early in life, as a child, as a teenager, as a young adult. So here's a study where they looked at people who had trauma, and the people who had Alzheimer's disease had a lot more history of head trauma than those who did not have Alzheimer's disease. So it's, again, another type of correlational study, but it does give us some fear about head trauma may be a risk factor. So protect your brain if you're doing any kind of activities. Again, this is a really good tip to give your kids and grandkids, that don't ride a bike without a helmet, don't ski without a helmet. These are really important things. Cognitive activity. This is my favorite thing, because I think that this is something that we can all work on. We know that people who are not cognitively active over the age of 65, they're much more likely, 2.5 times more likely, to develop Alzheimer's disease. And being cognitively active is also like being in social activities. So the number of people in your social network can also affect how cognitively active and functional you are. So a person who has more of a social network, is interacting, whether it's on Zoom or in person, they have better cognitive function than people who are not having social interactions. So here's lifetime cognitive activity and the levels of this amyloid beta protein in the brain. People with the highest cognitive activity over here on the right side had the lowest amount of the amyloid. People with the lowest cognitive activity had higher levels of amyloid. So what type of mentally stimulating activities can really be good for the brain? And I think anything on this list is good. But what's really important is that you pick new things, not doing the same old things over and over again, because that's not so engaging to the brain. So new puzzles that you haven't done before, crossword, Sudoku, traveling to new places, when we open up and there's more vaccine around the world, traveling and meeting people and going to new places is really good, engaging activity for the brain. Gardening, reading. Not only reading, but being in book clubs where you're discussing the books that you've read. Movie clubs, so not only watching movies on TV or on Netflix, but talking about them with other people. So it's more than just watching TV, because that is not a very, cognitively engaging activity. It's talking about it, and that social interaction seems to be really important. Playing new card games, learning new card games, learning board games, chess and checkers, learning a new musical instrument, going and seeing new museums, or attending plays or talks like you are attending this one. These are all really important. My uncle, who is now 76 years old, last year during the pandemic, he said, I'm going to learn something new. And he learned how to crochet. He had never done any crocheting. His mother used to do crocheting. And he said, I always wanted to ask my mother, but now she's dead. And he learned on his own, reading and watching videos on YouTube on how to crochet. And he made a tablecloth, an amazing tablecloth. So you're never too old to learn something new, and it's really good for the brain. So keep your mind active, do a lot of different new activities with your brain to keep it active. Stress. We know that people who have more stress can have more of these tangles in the brain. So people who are more resilient, that they have less stress because they have ways of always being kind of positive and coming out of stress, have many fewer of these tangles in the brain. So something to think about is like, what can you do to decrease the stress in your life? A lot of people find that being around people, talking to family, that helps their stress levels. Yoga can help stress levels, pranayama, meditation, reading, music. These are all some, stress relievers. So avoid or overcome stress the best you can. And the last one is physical activity. Currently, 30 minutes a day of moderate exercise, just walking, is recommended for all adults, but only 26% of adults do get that much exercise. 74, so 3/4 of Americans do not get the recommended 30 minutes a day. Why is exercise good? So those pictures of the brain I showed you, exercise can help make new nerve cells in the brain. It can help build new blood vessels, all those thousands of blood vessels in the brain. It can help build new blood vessels. The blood flow itself gets going when you exercise. Even walking, your heart rate goes up, and that means there's more blood flow to the brain, and the brain loves that. Because when there's blood flow, these new blood vessels are forming, there's new nerve cells forming. One of the studies that I think is great showed college age kids who were studying for exams, and they took kids and they said half the kids they got randomly assigned to exercising after a few hours of studying very intensely. Go exercise for half an hour, come back and start studying again. The second group, no exercise, just study through. And they got the same amount of studying time, but this one group was exercising. The group that was exercising actually remembered the things they were learning much better than the group that didn't exercise. That is amazing. So this is why exercise seems to be beneficial for memory in the brain. We know that people who exercise regularly 3 times or more per week in this dark line have less risk of developing dementia. And in people who are exercisers, much less beta amyloid levels are seen than people who are not exercisers. So that's our last tip, is get regular exercise. Walking is great exercise. If you cannot walk because of other medical issues, then there are other ways to exercise in your home, in your chair, using your arms, using weights. These are all really important because they get the blood flow up. So the good news is that number 3 to number 10 are all modifiable and in our control. And it's never too late. That's really positive. So in this study, where they looked at people who had never done these activities, and then those who had started doing them in middle life or in late life or middle to late life, and started taking up artistic activities like painting or doing pottery, even learning new activities later in life had less risk of developing Alzheimer's than never doing it. Learning other crafts, middle life, and look at this, even later life seems to be better than in middle life. So picking up a new craft and activity was good for the brain even later in life. Social activities, computer use was really beneficial even later in life. And activities that you do after the age of 90 also seems to be associated with less risk of Alzheimer's. So people doing these activities have less risk of developing Alzheimer's. So to end, what can you do besides all these things I've been talking about to keep your brain healthy? everyone can contribute to what's going on with our understanding of Alzheimer's. You can advocate for people you know who have Alzheimer's or who are having problems with early memory loss. You can donate to associations like the Alzheimer's Disease Association, other places that are doing research for Alzheimer's, and you can participate. This is why I'm here. So as Siali mentioned, we have set up this new registry. It's called CARE, Collaborative Approach for Asian Americans and Pacific Islanders, Research and Education. It's a database we're putting together with adults, 10,000 Asian adults who want to be contacted about being in future potential research studies. And the topics of these studies can vary from dementia, aging, caregiver-related research, other health topics across the lifespan. And so this is just putting your name in a database. It's very simple to do. You can enroll by completing an online survey that takes 10 to 15 minutes. They ask you questions about your background, where you were born, your general health. Have you ever been a caregiver? Do you know anyone who has dementia? And you get $10 if you sign up to be in the registry. And you can easily access the registry by Googling Care Registry, UCSF, but we will also send you this information by email. So I encourage you to join, because right now I can't tell you how many Asian Indians or Asians have Alzheimer's, because they're not represented in the studies we have. And that is a shame that we won't be able to know. So with that, I'm going to stop sharing and the screen, and hopefully there's a lot of time left for you to ask questions.
Yeah, thank you. That was very useful information, Alka. And everybody is interested in knowing how they can take care of their health at any age so that they do not develop certain conditions like dementia or Alzheimer's. So everybody, if you have any questions, you can either unmute and ask, or you can put it in the chat box. We will start with the first question that somebody has already put in the chat box, and that is, what do you think of combining all these 10 tips that you gave along with some sort of alternative medicine like acupuncture, acupressure, Ayurveda, and things like that?
Yeah, no, I think there's many benefits of acupuncture and acupressure, especially on, pain, on stress, on people who are having certain conditions, migraines or abdominal pain, so there's many, many good benefits of acupuncture and acupressure. And if anything, I think if it causes you to have better sleep, better stress reduction, less pain, then that's going to be beneficial for your health. And it can also be good for your brain health. So I have no problems with that. But there's no good study saying, yes, it is definitely, you must combine this. I can't quote any studies.
Mm-hmm. Yeah. Who else has a question?
I do.
Yeah,
this
go
is
ahead.
Naina
Hi,
Ramkrishnan.
Naina.
Hi. This particular presentation that you made, Alka, if I don't have to call you Dr. Alka.
You don't need to. Yeah.
Okay. My husband does have Alzheimer and has had it for the last, I would say, 5 years at least.
Yeah.
And I don't, but he's not, terrible. I mean, no bedridden, nothing. He does all his grooming activities and everything.
Good.
It's just that he's not at a functional level.
Yeah.
Which is, paying the bills, driving by himself.
Yes, the executive function has slipped.
Right, and he really has been very, very intelligent his entire life. So this came as quite a surprise.
Yes,
but whatever it is, and I'm not going to say that it's been easy or anything. And being a caregiver, I really feel that I have to make sure that I don't lose any of my faculties or memories or whatever, because
very
we're
important.
really on one brain here.
Yeah, I know. You're so right.
And we travel to India once in a while, and we go to Florida, and we had a house there for a few years and all of that. So his quality of life is very good, and I want to keep it that way.
Good.
But I have things like high blood pressure and diabetes. And
so you
sorry,
have to take care of yourself. Yeah.
No, I really do.
Yeah.
And, you know, we make sure we walk every day.
Good. Great.
That 30 minutes.
Good.
We each have a Fitbit, and so we can track it and monitor it.
Good.
But now I am concerned for myself. You know, with Ram, I think I'm doing as much as I can. But for myself, the high blood pressure and the fact that I'm taking so many medications, and you may know which don't do well with each other and which do, but how do I find out that my blood pressure medicines do? And then thyroid one.
Yes.
Cholesterol one. I mean, I worry that that's taking a toll on me. It's not fixing anything as much as it is maybe hurting something. Well, that I don't want to do.
Absolutely. So here's what I would recommend is you need to you've completely, hit the crux of this situation for yourself is you have to take care of yourself, because if you don't take care of yourself, you can't take care of your husband. Right. So I would recommend you see, your healthcare provider very regularly. You take in your medications. Just showing the physical number of bottles that you take is an eye-opener to many doctors. They don't realize when they see it in the chart that you're on 10, but when they see that you're on 10, everybody wants to make sure you're taking the least amount and the most beneficial medications. Certain medications may not be beneficial as you age, and you may not need to be on them. Thyroid medication is absolutely necessary for someone who has low thyroid, because again, you get memory loss if you don't treat your thyroid, and you want to have that thyroid medication is really important. Blood pressure medication is important because we don't want your blood pressure to be, sky high, because that can cause strokes and other problems with the brain. So, but are you on just the least amount that you need to be on? Are you on any that are interacting? So I would really do a consultation with your doctor, and you can do a consultation with your pharmacist too, because a lot of pharmacists know really good about any interactions. Make sure you're not taking the thyroid medicine with anything else, because the thyroid medication doesn't work well when you take it together with anything, especially vitamins. Can't combine them.
So then something like at night, take some and take some in the morning.
Exactly. So that's your doctor and your pharmacist together can help you decide which ones absolutely should be in the morning, which ones can be at night, and you don't want to skip, them, and you want to take them correctly. So take care of yourself. Walking is great exercise. I'm so glad you're doing that, you and your husband. Keep him active, keep him engaged, so he's using his brain, reading, writing, puzzles, those things are really important.
Right. Yeah, I understand. Thank you so much.
Okay.
Okay, who has another question?
There are some questions, Hailey.
Yes, go ahead.
Hi, Alka. Again, I'm taking liberty to call you by your first name.
Sure, no problem.
I'm 77 years, about to be 78-year-old male. And all these conditions, blood pressure, high cholesterol, and all that runs in my family.
Yes.
And for last, I think 8 or 10 years before that, I was kind of negligent about them, or doctors even didn't stress that thing to me. But for last 10 years or so, everything is under control.
Good.
As a matter of fact, my HDL is 20 points higher than LDL.
Good. Wonderful.
Yeah. And in 1998, I had a bypass surgery, portable bypass. And thank God since then, I have this thing. Good. But controlling myself. Good. Like for cholesterol, for high blood pressure, high blood pressure, some doctor told me what you have is essential high blood pressure, hypertension.
Yes.
How do you control that? There's no way but the medication.
Well, that's the thing is, low salt diet, less alcohol, exercise. These are all good for blood pressure control. But as we age, the arteries become stiff. And that you can eat the best diet. You can eat 0 salt and you can exercise every day, but your blood pressure may still be high because the elasticity of the arteries is gone. And so blood pressure as a result goes up. So it's kind of an aging process of the blood vessels that causes essential hypertension. And so that's why we need medications to help control them, because the medications work in different ways by relaxing the blood vessels so that they're not so tight and hard. And so most people after age 60, 65, honestly, will need one blood pressure medication. After age 75 may need 2 or 3, because as you age, these blood vessels become more, more stiff. And it depends on your family. It's genetically also associated. So if your father or mother also had high blood pressure, you will also definitely, as you age, have high blood pressure. And you can do the best you can with your diet and your salt intake, but most will unavoidably need to be on medications, unfortunately.
Like some people don't have any problem with salt. My
Yeah.
father at 70 years old, he ate the salt 3 times I eat.
Yeah.
Was 20 or 80.
Yeah, well, maybe he has better genes.
But in
Yeah.
those days, there was, no regular testing for diabetes and hypertension and all these things.
We don't know if his blood pressure was high. And also, there's different stressors in our life. We have a lot different stress levels in our life here in the US than maybe, someone else in a different country had. There's many reasons that there's high blood pressure, but one is definitely a biologic reason, the one I was mentioning.
All right, Alka, thank you.
Sure.
Yeah.
I'm muting myself.
We have a question from Prakash. He says, I have Parkinson's. Is there a diet component to reducing dementia and Parkinson's? And also, I have lost my voice and soon will be going through thyroplasty next month to restore my vocal cord tension. Is that something you would recommend?
Yeah, I can't speak to that. I'm not an expert in that procedure. So I would ask your, specialists would hopefully give you some good information about that. But in terms of your diet and what can you do, I think the things we've been talking about, the leafy green vegetables, making sure that you're getting good amounts of folate and vitamin B12 in your diet, whether it be from walnuts or from omega-3 rich foods like the fatty fishes. Those are all really important. I would get your vitamin B12 level checked to make sure you're getting enough B12 in your diet. If you're not, you can take a vitamin B12 supplement. But all of those healthy foods that I mentioned, berries, nuts, walnuts especially, leafy green vegetables, fatty fish, those are the things I would really, recommend in the diet.
Mm-hmm. I had a question. So, is there a test that people can go through or ask their provider to give them so that they can detect if they have a genetic predisposition to get Alzheimer's or dementia? So can you talk a little bit about that?
Yeah, there's a lot of people working on these, genetic risk scores to say that someone who has a very high genetic risk score with all those small mutations that I showed you on that slide, that there's many, many different genes that may be related to memory and executive functioning, and there may be genetic abnormalities in many of those genes. There's no one test that's available now, but I think in the next 5 to 10 years, that's the pace of the research. It's going crazy in these areas. Is, can you do a risk score even at birth? Can a baby that's born, can we do a genetic risk score saying this child has 50% risk of developing Alzheimer's disease as they get older? And can that child then for their whole life do the right things, eat the right way, make sure they wear a helmet anytime they, play any kind of sports, make sure that they're getting exercise, do a lot of cognitive brain activity? Can people, change their behaviors early in life knowing that they may be at higher risk? I mean, that's the future of medicine, is really being able to personalize your risk. But I'll tell you myself, I'm a general internist and I talk to people about changing behavior all the time. That's what I do. I'm in the prevention medicine game. And I wish it was that simple, saying you, sir, or you, ma'am, have a 30% risk of developing diabetes. You need to start doing this. It doesn't seem to really make much of a difference. People who are going to change their behavior are going to do it when they're ready. And it often takes a kind of a near call, like having a heart attack, and then people start changing behavior because they don't want to die. They had a close call, those kind of things, or seeing a friend who develops something and then that's a close call for them. So it's not as easy as saying you have a 30% risk for Alzheimer's. It doesn't really change behavior because you don't think about it, right? It doesn't keep coming up to you. And so
Right.
so, but I think in the next few years, we will have these risk scores available for heart disease, for diabetes. There are already some for heart disease, but here's the sad part. These are all scores done in white Americans, white Europeans. There are no Indians in these studies. So you have no idea if the risk score you get that has been done in whites has anything to do with your risk, because they weren't made in South Asians. So that's really why I'm here, is that if you don't, aren't in studies that are doing these risk scores, that are doing these, interventions, we don't know if it works or doesn't work, or works in a different way.
Yeah, so it is very important for South Asians to register and be a part of these registries. So whenever there's a study on health issues, they will be able to recruit us. And so we become a part of the research study. So we know what works with our bodies, or what is
Exactly.
how it goes. So I'm going to email everybody that link and that information you sent. So especially anybody over 50 years of age, we highly recommend that you register. It's a small form. Just click on it and enter your information, and it will just be a part of the data set. And they will call you if there's a need to recruit. And then you can either say yes or no, depending on.
There's no obligation to join, and each study is different. There may be some studies for caregivers like you, Naina, people who are taking care of spouses or loved ones who are going through early stages of Alzheimer's. There may be research studies to look at caregiver stress. How can we help caregivers have less stress? And there may be studies about just healthy aging over the lifespan. So again, there's going to be different types of studies that you will get contacted for, but we really are trying to get Asian American representation into studies, because in all the studies that have been done in the United States and all the money that is spent by the NIH, only 0.17% of studies have Asian Americans, in mind when they're doing these studies. 0.17%. And Asian Americans, Pacific Islanders, make up 6% of the US population. They make up 60% of the world's population, okay? But 0.17% of NIH money goes towards research in Asian Americans. We need to change that. This is clearly something that our communities need to get involved. And I'm hoping that you reach out to your friends, your families, have them, think about getting involved. And again, no obligation to join. You're just putting a name in a registry.
Yeah, that's very useful information. We have a few minutes left. Anybody has any other question or comment? You are muted, Naina.
No, I just, I have every book. I have listened to enough TED Talks on this subject, but I have to give credit to Alka. You were, I was trying to furiously write down the notes of all that you had in your PowerPoint presentation.
I'm happy to share that.
Most of it.
Okay. I'm going to share that with Sally. I'll send her my PowerPoint slides as a PDF, and you guys can all share it and give it to your friends and family.
Really
it's just try to make it simple and make it, user friendly. Yeah,
absolutely. But I have 5 pages already, so
that's
I
good.
Just want to tell you that you have been the best.
Oh, you're sweet. Thank you so much, Neda. Very appreciate your kind words.
Yeah, and we have the recording of this video. So if you want to share it with anybody, particularly who you think might benefit from this information, we can do that as well. So if nobody has more questions, we will stop here. I just want to let all of you know that next month, Alka is coming back, and she's going to talk more about the chronic diseases that South Asians face. And she's actually going to talk about her 10-year-long study, masala study, where she focused on South Asians. So that will be very interesting. Again, good information. So hopefully you'll join us again, and also let your friends know. Yeah, it is going to be on 16th of May. It's a Sunday again. So I want to thank Dr. Alka Kanaya for giving us this valuable information about Alzheimer's disease and about taking care of our brain health, as well as about the care registry. Thank you very much for joining, everybody, and have a good afternoon, good evening.
Okay.
Thank you. Bye. You too.
Thank you all very much. Sally, I'll send you the PDF of the presentation, and I'll also send you a